magic switch inside of us that goes boop. Now my milk has no nutritional value. Hello to all of you beautiful birthing people. Welcome back to my channel. My name is Elizabeth. I am a labor and delivery and postpartum nurse, certified childbirth educator, mama to 3 babies who I have exclusively breastfed and also exclusively pumped for. If you want more info on that, I have a bunch of videos on exclusively pumping as well. And today I wanted to come at you guys with a video about 10 myths that I hear a lot working with brand new families who are working with breastfeeding. Without further ado, let's go ahead and jump into these myths so that we can get rid of them for us. The first myth that I hear time and time again, it's always like grandma's in there talking about it, or somebody's in the room telling this woman who has just given birth, putting the baby to the breast, it's normal for it to hurt. You need to toughen up your nipples. My mother told me when she started her breastfeeding experience back in the 80s and 90s, they told her to get a scrub brush and scrub at her nipples in the shower to toughen them up, that they needed to toughen up, they needed to get some calluses. What do we know now? That is absolutely, completely false. Please do not do that because you're gonna hurt yourself. Said it once, I'll say it again, I'll shout it from the rooftops. Breastfeeding shouldn't hurt. It shouldn't hurt. Might it feel a little bit odd? Potentially. Might you feel a little bit sore if you've had a latch that maybe wasn't perfect every single time? Possibly. But should you have cracked, bleeding, tender nipples where you want to throw that baby across the room? No. No, you should not. Now, there are a bunch of things that can make breastfeeding uncomfortable. And really what they all come back to is that the latch is not adequate and baby is using compensatory mechanisms at the breast. So when a baby is latched, they should have a nice wide open mouth. They should have the ability to extend and move their tongue. The tongue is what's really doing the work here. And they should have the ability to freely swallow. So when we are latching a baby to the breast, you want to make sure, this is the key. This is the thing that I feel like when I come in and somebody's like, oh, this is a little bit sore, and we tweak this one thing, it does the ticket. We want to make sure that we are leading with that chin and that there's space right here between the chest and the chin, so that baby can have that nice, big, wide open mouth. And if you lead with the chin, and then they come at the breast, we can get that nice asymmetrical latch where we have more of the bottom of the areola in the mouth than the top. And you also then have the ability to make sure baby can totally breathe, no problem. Baby can do all those things. Because if you have a baby who's coming in like this, and what are the 3 things we need to do? Open our mouth really wide and stick out our tongue and swallow. Really difficult to do. They're going to have a tight mouth. Whereas if they come in with that head tilted back, so you're guiding their shoulders in, they can do everything that they need to do. It's not easy. It's a bit like that scene in Talladega Nights when we're first getting started, right? And you're kind of like, I don't know what to do with my hands.
I'm not sure what to do with my hands.
Be good just to hold them down by your side. Yeah, great.
Well, we're real happy with what was going on. And at the end of the day, you know, you got to be happy.
It's tough. And there can be things that make positioning and latching difficult. Baby might have been coming down asynclitic or crooked or in a position that was less than optimal for birth, and they are still really, really, really tight from birth, and they have to do some stretching out. That's why for a lot of people, immediately afterwards, you know, things are sore and then it gets better. It's because that baby has had the ability to really stretch out. But we can encourage them to do that before so that we aren't getting sore. The other thing that could be an issue is a tongue or a lip tie, or a baby who has really, really low tone. Can all be things that make our babies need to use compensatory mechanisms, biting, chomping at the breast to get that milk to come out. And just because your baby's gaining weight does not necessarily mean that they have a good latch. Sometimes that means that you just have a really robust supply. So if you're painful, if you're sore, if you're worried at all, seek out care from an international board certified lactation consultant. So when we're talking about how breastfeeding shouldn't hurt, I think it goes without saying, but maybe it doesn't, that pumping shouldn't hurt either. Okay? And really what we're looking at here is this myth that is perpetuated by the breast pump companies themselves. I don't know why they do themselves dirty like this. It literally makes no sense. So when you buy your breast pump, it comes with either a 24 or 25 millimeter flange and a 27 or 28 millimeter flange. And for about 90% of those of us using a breast pump, those flanges are too big. But if you're thinking, oh, well, I must be a 24 or 27, you kind of make whatever work. That's what I did with my first pregnancy. I didn't even realize. But when I started exclusively pumping with my second baby, these puppies were sore. They were hurting. So what I did is I went and got professionally sized, and I was a 21 millimeter flange. So I went on Amazon, and there are a couple different retailers that make compatible smaller flange sizes for both Spectra and Medela. That worked out pretty well. When I was using an LV, when I was using a Willow, I did need further sizing down and comfort for my elastic nipples with my Beaugen cushions. But with this pregnancy, I actually found out that my nipples got smaller. That's right, your flange size can change throughout your pregnancy, throughout the postpartum period, and then it can be different during the same breastfeeding duration. So it's important if things start to feel uncomfortable to resize. For measuring your flange size, I like a millimeter ruler. You can get one off of Amazon, or there are several ones that you can print off online to use for that process. I will have them linked in the description. And how I got my comfortable fit this time is with my handy dandy Beaugen cushions. These guys for the win. I use this every single time I pump without fail. They are a clear and comfy silicone insert. It's like a little pillow for the nips that go inside this flange, size it down by about 1 or 2 millimeters. So it takes my 21 millimeter flange down to a 19 millimeter flange. And I absolutely love them. Now they have partnered with me for this video. They want me to talk about their pumping starter bundle, which includes this wonderful carrying tin that works a lot better than a Ziploc bag where things get all smushed in my bag, and then your very own pair of Beaugen cushions. So if you are having pain with pumping, if you need to size down your flange size, but you've already purchased a whole bunch of flanges, these are amazing, and especially if you've got those elastic nipples that I have. So definitely something worth checking out. If you use the code FREEDOM up until July 5th, you can get your very own pair of Beaugen cushions or anything off of their website with free shipping with no minimum order. So definitely something for you to check out, and don't live with the myth that 24 or 27 fits you. It might, but it might not. And if we have a properly sized flange, not only will we improve comfort, we will improve pumping output. The next thing that I want to talk with you guys that I hear really, really often is, oh my gosh, I totally lost my supply around 12 weeks, 12 and 16 weeks. My breast didn't feel full anymore. I just totally lost my supply. I was pumping 8 ounces at a time, and then I went to pumping only 4 ounces at a time. This is the tricky part. This is really hard to wrap your brain around. Around 12 to 16 weeks, your body that has been pumping out this milk for your baby is like, okay, I see how much they need. I see how much they want. I'm gonna adjust, and I'm gonna make that perfect amount for them. So your breast all of a sudden might not feel as full and engorged in between feeds, and your pumping output might decrease slightly, but it still ideally is going to be enough for your baby. And if it's not, then we need to troubleshoot some other things. But ideally, your baby now is getting the perfect amount from the breast. And this is the other part that can be tricky, particularly if you're not pumping super frequently. Pumping is not a wonderful direct look at how much your baby's actually taking. Your pumping output does not always equal how much your baby's taking, because a lot of us do struggle to have letdowns with the pump, fully empty with the pump the way that we can with a baby. And that's why, again, properly sized flanges, comfortable pumping is so important, because that's one way that we can really help empty those breasts as well. But don't be surprised if your breasts around 12 to 16 weeks start to feel a little bit less full. It doesn't mean you're not making milk. It means that your body is doing what it's supposed to do and reacting to exactly how much milk your baby is taking out and replacing that milk. So another thing that I often hear in the hospital is I have patients say, oh my gosh, I didn't leak any milk. I don't have any milk right now. I need to wait until my milk comes in, right, at that 3 to 5 day range to have enough milk for my baby, or to have milk for my baby. And I know that there are some cultures that believe that colostrum is dirty, that don't want to feed their babies colostrum. But what I want you to know from a medical perspective is that you do have exactly what your baby needs in the beginning if they are latching well and if they are able to transfer milk, which not every baby is. And we're going to be screening for that and looking for that when we are helping you latch your baby. And we're going to be figuring out ways to get milk of some variety into your baby to make sure that they are staying hydrated, because that also is important. But colostrum is in starting at about the beginning of the 3rd trimester. We start making colostrum for our babies until that hormone cascade happens with the placenta's release at that 3 to 5 day mark that tells your milk to come in. So you do have enough milk for your baby in the beginning. It's just colostrum. When we say your milk's coming in, what we mean is your mature milk. So your baby's tummy is about the size of a cherry. It's not very large. It does not need very much. And when you are breastfeeding your baby in the beginning, what we're going to be looking for are swallows. We're going to be looking for wet and poopy diapers to tell us good indications of their hydration status. And if any of those things are changing, then we're going to address that as needed. But simply thinking that you don't have any milk yet is just not the case. It's just that we're waiting for your mature milk to come in. It's a bit of terminology difference there that is important to differentiate. But speaking on that, I think too that a lot of us get into this mindset that breastfeeding has to be all or nothing, right? We have to breastfeed solely from the breast, directly from the breast, or we have to make enough milk that we're pumping, and if we use formula, we might as well just throw in our deck of cards and switch exclusively to formula. And I totally understand if your goal is to exclusively breastfeed and to only give breast milk, and maybe that's not working out as you had planned. But the benefits of breast milk are seen even if baby is only getting a small amount of breast milk a day and then additionally some formula. So it is okay if it's not all or nothing. The main goal that we have when we're looking at breastfeeding is that we are making sure the baby's getting fed. So that's one of our first goals. Then we want to help you meet your goal. And if that is exclusively feeding baby from the breast, definitely a goal that we want to meet. And then we want to work on protecting your milk supply. So if baby is getting formula and your goal is to eventually get baby to be directly feeding from the breast, there might be some extra pumping that goes in there to tell your body to continue to make that milk or to start making that milk that baby is getting from their formula supplementations. But if you're okay with doing 50-50 or 75-25 or whatever combination, you do you and do what works for you and for your baby. Our goal is to help you meet your goals. For real. That's our goal in the hospital. But somebody might tell you, oh, if you give your baby a bottle of formula at night, they'll sleep better. And the studies actually show that babies who breastfeed are giving their parents 45 minutes more of sleep in a night. But I do understand that if you are giving a bottle of pumped breast milk or a bottle of formula, that's a chance for somebody else to feed your baby. And for you, that sleep might be more valuable. And I totally hear you and I totally see you, because sleep plays a really big role in our mental health. But simply giving your baby formula because you think formula is going to help them sleep is not always the solution or the answer that we think that it's going to be, is what studies have shown us. The next thing I want to talk about is extended breastfeeding. There are still providers, pediatricians, who will tell you, oh, your baby's one, they don't need breast milk anymore. There is no nutritional value. They should be getting everything from food. But at the same time, we'll turn around and tell you to give them cow's milk. So it's not like there's a magic switch inside of us that goes, boop, now my milk has no nutritional value. My baby is 12 months old exactly, and my body knows. And the American Association of Pediatrics actually just came out with a statement that said, hey, we need to be exclusively giving breast milk for 6 months, breast milk formula 6 months. After that, breastfeeding relationships can continue to 2 or beyond, as long as it's mutually agreed upon by the baby/child and the person that's breastfeeding them. And that is a big difference, because they used to say to the age of 1, now they're saying to the age of 2, which does more closely align with what the World Health Organization recommends. So if your baby's hitting 12-month mark and you're like, I thought we were going to be done breastfeeding, it's okay if you want to be done, but just know that it's normal for them to want to continue breastfeeding. The average age of weaning globally is around the age of 4, which in America definitely makes a lot of us uncomfortable. I personally don't see myself nursing my baby until the age of 4, and that's okay, because it needs to be a mutually agreed upon decision. But if you want to go past 12 months, just know your milk does not lose nutritional value. Yes, we need to be working on solids and table foods, and if we're having issues with that, we want to meet with somebody to help us and help our baby master those skills. But breast milk is still a comfort, and it's also so much more than just nutrition for our babies and our children to breastfeed. The last 2 that I want to talk about have to do with what your body does in response to breastfeeding. So we have heard time and time again, oh my gosh, breastfeeding, all the weight just dropped off of me. And the reason why for some people this happens is because there is an extra calorie need when you are breastfeeding of about 500 calories a day. We want to make sure that we are taking those in healthily, although spoiler alert, sometimes I take them in as like 5 or 6 Oreos. So that being said, it's ideal if we are taking in some good calories that are giving us energy to give our babies energy through our breast milk. For some of us, that extra calorie need coupled with what we're eating puts us in a little bit more and easier of a calorie deficit, and that weight falls off. That has always been the case for me, so I know that it does happen. And when people ask me, oh my gosh, Elizabeth, like, how did you lose weight after having a baby? Genetics and breastfeeding and nothing that I'm doing, and I just was lucky. But that's not the case for everybody. And it's okay if you hold on to weight when you're breastfeeding. There are a large majority of people who do so because their body's like, wait, this extra fat storage, this extra whatever is needed for my baby. And you hold on to that last 5, 10 pounds or more until you're done breastfeeding. So do not feel discouraged if that weight does not just melt off your body. It's not necessarily supposed to. We are all built different. We all have different genetics that influence our set weight and our weight when we're breastfeeding. So if you're one of those people that holds on to a little bit of weight, I know it's difficult, but I don't want you to feel like you're a weird outlier because you are not alone. This happens to a lot of people. And then the last one I want to talk about is getting pregnant while you're breastfeeding. In my educational discharge packet that the hospital provides, that our physicians provide for their patients, there is a bullet and it is in all caps. Breastfeeding is not a form of birth control. Let's break that down a little bit because it kind of is, but it also isn't that reliable, and that's the issue here. So when we're using breastfeeding as a form of birth control, it's not something that I teach people to do because it's not something that's really that foolproof, and in our modern society, it's not something that's actually that easy to sustain. So if you're using breastfeeding as a form of birth control, this actually has a name. And this is the lactation amenorrhea method, or basically you're breastfeeding so you don't have a period method. When you're breastfeeding, your estrogen and your progesterone levels are suppressed by the prolactin that is circulating through your bloodstream. Basically what happens is that you don't ovulate. And so without ovulation, there's no egg that's being released that can be fertilized by any sperm. Sounds like a win-win, right? But it has very tight parameters that you have to follow that most of us don't follow at all. And if following all of these parameters, it actually can be as effective as hormonal birth control, but it's really hard to follow all these parameters. So I'm not telling you to do this. I'm telling you that you can get pregnant doing this because some people do get their periods back as early as 4 to 6 weeks postpartum. So you can't have gotten your period back, can't have had a period. Your baby has to be younger than 6 months of age. You have to be breastfeeding every 4 hours around the clock. No pacifiers, no bottles, no solids. Some people say you have to be feeding directly from the breast. You cannot get even pumped breast milk. And if doing all of those things, potentially you can stave off ovulation. But here's the kicker, and this is where people get stuck. This is where people are like, I didn't know I could get pregnant. Here's your little anatomy lesson. You are going to ovulate before you have a period. So there's this weird little gray window where you've ovulated, maybe didn't know it, and you haven't even had a missed period yet, and you can get pregnant. And if you're trying to avoid it, this is where we really want to be using an alternate method of birth control. Okay? Now for some people, they don't get their period back until they're done breastfeeding. I never did. We're all a little bit different, but I just want you to be aware that you totally can get pregnant. And when you're breastfeeding, sometimes your periods are super wonky and like your cycles are not well regulated. And that's why it's really easy to, accidentally ovulate. Because you know what happens when you ovulate? You know what happens? I'll tell you. You want to get down to business. Your body's like, hey girl, let's get us some sperm. And then, boom. Boom, pregnant. And Mother Nature's like, we're carrying on the human race. And you're like, this wasn't how close I wanted my kids. So just something to keep in mind. You can get pregnant while breastfeeding. Do not use it as a form of birth control because it's really hard to keep all those really tight parameters in place. And with that being said, what other myths have you heard? What other myths do you want me to debunk? Leave them down below. And until next time, bye guys.